The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to talk about a serious but important subject, natural disasters and their impact on us, not just physically, but our mental health. And joining us in the studio today to talk about this is a psychiatrist who's been trained in both adult and now doing a fellowship in child and adolescent psychiatry, Dr. Borge. And you're from Pittsburgh, isn't that right?
Yes.
And you got interested in psychiatry and helping people in this way. How?
Well, you know, after the recent natural disasters going on with our country and also overseas, I was wondering, you know, what kind of mental illnesses one can, expect and occur. So I was wondering, I would like to know more about this, and I was thinking of what I can do
To help.
So I got interested.
So this is, this is a large group you're working with today. I mean, you're going to impact, with the Lord's help, a lot of people and hopefully give them, you know, some insight in what's normal, what's not normal, and what can really help them.
Absolutely. I mean, the goal is here to educate the people. You know, I feel very sorry for what people and families have gone through and are going through. Mm-hmm. And what I would like to do is, you know, see how I can help by educating them,
right,
by telling them of information that can be helpful to them so that they can, have better lives and be able to deal with the stressors in a much better way.
Now, you and I have talked in another program, which if people are interested in that, they can get it from 3ABN, on children and the impact of natural disasters. But we want to talk about adults in this particular segment. But first of all, we want to define what a traumatic or natural disaster would be, and then look at some normal reactions, and then look at some risk factors before we then look more specifically at some specifics. So first of all, what is the definition of a natural disaster or a traumatic event?
Yeah. Anybody who has gone or experienced event or events after a natural disaster undergoes through what is called a traumatic stress reaction. And a traumatic stress reaction is a person who has eyewitnessed or experienced events in which the physical and integrity of themselves or others has been threatened, have experienced what is called a traumatic stress reaction. And
lots of people could go through that then. I mean, like medical workers, emergency workers, fire workers.
Absolutely. And those people who are involved in those areas where the stress and mortality is high have also experienced what is we call trauma. Mm-hmm. According to the American Psychological Association, approximately 70% of U.S. adults have experienced at least one traumatic event in their lifetime. And 1 in 5 go on to develop symptoms of what we call post-traumatic stress disorder.
Would you consider seeing, like I watched when the Twin Towers fell, September 11th, is that a traumatic event? It was to me. At least I saw people physically jumping out of windows. Was that a trauma for the whole country? Would that count as one event?
Yes, absolutely. You know, if you have witnessed a traumatic event to that magnitude, it's definitely traumatic. But I think it depends on the individuals. Some people who have witnessed different types of trauma in their lifetime before may be more resistant to developing trauma after witnessing something like that, whereas others who have not and who felt like probably, you know, it is very safe to be in America and safe to be in that probably in that area, and that nothing like this would happen to them it might be very, very traumatic compared to someone else. So, but definitely witnessing a traumatic event where the integrity and a danger was involved to the person or others also is a person can also go through what is called a traumatic stress reaction.
So, I mean, living in Florida would be kind of traumatic at this time. Living in different places, or seeing it on television, all these things kind of add up.
Absolutely.
So this is very important to talk about. What are some normal reactions to these traumatic stressors?
Yes, and I think that's very important to keep in mind that these are normal reactions,
Okay.
because after experiencing trauma to this extent, that you are expected to undergo certain normal reactions. For example, we can talk about emotional reactions where you can have shock, denial, anger, resentment, can feel abandoned or estranged from people. You can feel betrayed. You can feel depressed.
Or patriotic.
Yes, absolutely, you can. You can feel patriotic also. You can feel a lot of psychological distress. You can have flashbacks of the event. You can have nightmares. You can feel, have all these distressing images or memories. You can have memory loss of the event. You can have physical reactions to the trauma. You can have chest pain or discomfort. You can have abdominal pain or distress. You can have physical tension, fatigue. You can feel paresthesia or numbness of the extremities. You can have headaches. So these are some of the physical symptoms for trauma.
Interpersonal situations or reactions that are normal?
Absolutely.
These are all normal, by the way, what you're telling us about.
Absolutely. Interpersonal, people can get more, have difficulty with their relationships with their spouses, with their families, with their children. They can get more edgy, more irritable with their relationships. They can feel, like I said, betrayed. They can feel abandoned. Sometimes they can feel like the responsibility over them is overwhelming, especially for a male figure who is the head of the household might feel that, okay, this is so much that they have to take care of and deal with. So they might feel more anxious and more stressed out.
And spiritually, I imagine some people would be angry at God, and some people would say, I don't want to have anything to do with God anymore, and some people would get closer to God.
Absolutely. Some people can look at this as, God, where were you? Where were you when I lost my child, when I lost my spouse? Where were you? Why did you let this happen to me? And they can be questioning God over and over. They can get very resentful with God. They can get very angry. They can lose their faith in God. Whereas some people can look at it as sign from God saying that they need to change their lifestyle that they were living, and they might become more closer to God.
So those are normal reactions, but let's quickly go through some of the risk factors. In other words, those are normal reactions, and those, as they play out, are actually a healthy thing. They're a coping mechanism, maybe you would call it that. But what about risk factors? What are some of the things that are very, well, risk factors?
Yeah, some of the risk factors are like if you lose communication with your family, with your neighborhood, with the community, that is a risk factor. If there's property loss,
Which
that's
was really
another.
big in these hurricanes.
Absolutely. That's another risk factor. If there's danger to yourself.
Fear of safety. Okay.
Absolutely. And if you see a lot of destruction or death around you, that's another risk factor. If there is a history of previous trauma, that's another risk factor. If someone has a medical condition that can worsen, and so you can have worsening of medical or psychological conditions, giving you a risk factor to get illnesses. Or
divorce, job loss.
Absolutely. You can, divorce and job loss is another stressor for developing trauma.
So all these are risk factors, and I mean, they're devastating in and of themselves. They're all major events. They're just huge, and I'm sure you see a lot of people that are just dealing with one of those things, but these are compounded in a natural disaster.
Yes. Absolutely.
Okay, well, we talked in a previous program about children, but now, we want to focus in this program more on adults, and there are some of these things that adults will experience that you mentioned, post-traumatic stress disorder, major depression, generalized anxiety disorder, and let's just work through those. What do those mean? And then hopefully what can we do about them? Post-traumatic stress disorder first.
Yes. Post-traumatic stress disorder, or what we call as PTSD, is also when someone has eyewitnessed or experienced situations or events in which they were threatened, their life was threatened or injured, and their reaction to that involved severe helplessness or horror is one of the things which constitutes PTSD.
So helplessness or horror, this is not just seeing it, it's actually experiencing it for sure.
Yes,
Okay.
yes. And the person re-experiences these events in a couple of different ways. They can have flashbacks about it, they can have distressing thoughts or images, they can have nightmares about this, they can actually experience it as if it were happening again, so which we call reliving the traumatic experience. Or they could develop sleep disturbances related to this trauma.
And so that is not a natural reaction. It's actually something that they're going to need to have help getting through.
Yes, actually, see, sometimes you can have natural reactions. You can have nightmares, you can have flashbacks, you can have images of the trauma again, as if you are re-experiencing them. But when it becomes to the point where it is going on for a long time and it is interfering with your social and occupational functioning, that's when natural or normal reactions are not normal anymore. That's when they go beyond that
So 5
state
years
of being
later,
normal.
you're still doing that, or even...
Sure, some studies have shown PTSD occurring years, even up to 14 years after the event.
So what do they do for this? What would you do? Someone comes in. How do we help someone there's people watching that are going through that? What do they do? First of all, acknowledge that this is what's happening just
Sure.
by what they've listened to now, and then what's the next step?
Absolutely. I think very important is to protect yourself. Safety is first. So, get away from that situation which you are in, which is unexpected, or you don't know what's going to happen next. You need to get yourself or others to a safe environment.
If
that
at all
is very
possible.
important.
Okay.
Absolutely. And then you need to protect yourself. You need to protect yourself from the natural, the cold, the weather that you're going through. Get the proper nutrition, the food, the clean water that you can have. So you need to take care of yourself in those
Basic
aspects.
ways, and then what's
Absolutely. You need to find out what is going on in the community with the resources around. You need to find out where there is help. You need to direct your families. You need to tell your families where you can meet, or what is the place that you can get together if something again happens.
So
you need
put
to
together
direct.
plans.
Absolutely,
Okay.
absolutely. And so directing families and your loved ones is important, so that one would know where to come and where to meet up with in case something happens again or something is ongoing. And then you need to you need to connect with the resources in the community where they're giving the supplies, or where they're giving the food
Right.
or the basic needs, or where there's information about where your loved one could be. You need to go and get involved with those and
Right.
Inform the people so that they can help you.
Should they see someone like you?
Professional help is an important aspect after one experiences trauma. If they're not feeling better after a couple of weeks, if they're not improving, if their symptoms are not improving, or if they feel that they're not in control, things are getting out of control, if they feel that, it's important to speak, not necessarily a professional or a psychiatrist, but you can start with maybe even your community, you can start and speak with your friends and express like what is going on and see how others are feeling, how they are reacting. Sometimes it's helpful, especially in mass disasters, when someone, when you speak to someone and let them know what you're going through, they're able to, express what they're going through too. So sometimes that might relieve your anxiety, or it might make things better. So that might not necessarily mean that you go and see a psychiatrist. So if you decide, if you talk with your family, if you talk with the community, sometimes if you think you need a little bit more help, if you talk to your clergy, if you talk to some teachers, and I think social workers and people out there are good at helping people and recognizing when one needs more professional help. So, for example, even talking to your primary care physician, your physician can determine if you need a little bit more mental help and then refer you to a psychiatrist.
When we come back, we'll talk about major depression. We'll talk about these other things and how to relate to those. Thank you for joining us. We're talking about natural disasters and their impact on mental health. And join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Manjula Borge. She is a psychiatrist from Pittsburgh, and she just has a real burden. She's seen the natural disasters, she's seen the problems that people are experiencing, and her heart has gone out. She said, look, I want to share some information that can be of help to those who are going through natural disasters, and we appreciate that. We're talking about the adults, and we've talked about how to diagnose whether it's a traumatic event, which sometimes is a no-brainer, and then what are the normal responses, what are some risk factors, and we were talking about post-traumatic stress disorder. And you said there's some other things that are typical. One of the things that happens is that people, if you're diagnosing or trying to figure out if you have this, is that you avoid family, you avoid these different things. Talk to me a little bit more about that, and then tell us a little bit more what to do if none of the things you've said so far are working. You've said so far, look, get in touch with your family and friends, talk to those that are significantly able to perhaps listen, like social workers and others, and your friends in the community. You've said also to make a plan if this happens again, get out of the situation if you can. But you also mentioned that there's avoidance that goes on of these very things, family, friends, and everything else. Mm-hmm. So explain that to me, and then what do we do about it?
Yeah. Well, in post-traumatic stress disorder, or PTSD, a person can also have what is called avoidance, where they avoid people, places, conversations, anything that reminds them of their trauma. That is also one of the symptoms. So they're avoiding places. They don't want to go to work, maybe. Sometimes they don't want to be involved in the activities that they used to be involved with or enjoy. They try to avoid their relationships or their family, and this is the way that they are, one of the symptoms that they are going through with PTSD.
Okay.
Well, what one can do more than connecting with family and resources around them is, once they get to their mental health facility and speak to a psychiatrist or a psychologist. Sometimes there are centers also, what is called Centers for Traumatic Stress, mm-hmm. where they have treatment for people who have been through trauma. That can be group therapy. Sometimes it's important to talk with people who have been through the similar types of trauma. I think that's very helpful for the person. sometimes they can have individual therapy with a psychologist or psychiatrist, or and depending on what their mental health professional decides, sometimes they might need also some medication to help you get through these traumatic symptoms that you're going through, these flashbacks, this reliving the experience, this anxiety, this fear, this feeling of numbness. So sometimes you might need some medications also, and then that depends on the mental health professional once they diagnose you. But you know, it's very important to go ahead and get involved with the different resources out there.
Now, there's other things that you've said can happen in a natural disaster. You've said major depression is another thing, and generalized anxiety disorder, panic disorders, and specific phobias. Let's go through those rather rapidly, because I want to then see what you would do. I think there's probably common ways to treat all of those. So let's go through them very rapidly to define what they are, and then we have about 7 minutes. We want to use at least 5 of those to talk about what to do. So let's go quickly through the, first of all, major depression.
Yeah, a person who has been through or going through what is called major depression is experiencing symptoms for a period of 2 weeks or more, where they experience depressed mood, difficulty with sleeping, that is falling asleep or staying asleep. They have they lose interest in things that they used to do before. They also have problems concentrating. Their energy is low, and they feel sluggish. Their appetite may be decreased or maybe sometimes increased. Some people have increased appetite. They feel guilty about what has happened or what is going on, or their reactions to what has happened. Sometimes there's psychomotor retardation or agitation. What we call is a person is a little bit more irritable when they're psychomotor agitated, and retardation is where they're kind
sluggish.
of more, exactly, sluggish. And then sometimes they can have suicidal thoughts.
Okay. So this would be, if all those things are happening, that you think maybe this is a major depression. What about generalized anxiety?
Generalized anxiety is when you know, there's typical, what we talked about, normal anxiety, certain amount of anxiety after a natural disaster, whereas generalized anxiety disorder is kind of more in areas of not just necessarily in areas that you get feel stressed out or traumatized about. It is even in other areas where
Small
probably
things,
you were
normally.
functioning normally,
Okay.
that you have excessive anxiety, where the person recognizes that this is excessive and this is unreasonable amount
They were
of
never
anxiety.
like this, sort of like the Bible says, men's hearts failing them for fear.
Yes, and then they find it also difficult to control this worry or anxiety that they're experiencing. And they can go, again, through physical symptoms involved with this generalized anxiety disorder, psychological symptoms, a lot of symptoms. And then this has to be for a period of, longer period of time.
Okay, panic disorders and specific phobias, and we're already to our 5 minutes, so very briefly on this, and then let's spend at least 4 minutes talking about the treatment.
Sure. Panic disorders is to discuss what a panic disorder is, we had to discuss what panic attack is, and very briefly, panic attack is a discrete amount of period of intense fear or anxiety in which symptoms are expressed in a period of 10 minutes or less. And some of the symptoms you can have in panic and attack is where you feel like you're getting chest pains, or your heart throbbing, or feel of choking, or feel of the sensation of nausea. You get probably headaches, and like I said again, paresthesias, or a lot of physical complaints in panic attack. So now panic disorder is recurrent episodes of panic attacks.
Those 10-minute episodes.
Yes,
Okay.
and then this can, in panic disorder, you can also have excessive concern of getting this panic attacks, and you also worry of the implications of
You
this
panic
panic
about being
attacks.
panicked. It's like really bad.
You worry of
Okay.
what's going to happen related to your job or related to your relationship because of this panic attacks. And then the person also makes major lifestyle changes because of this panic attacks. And for example, a person who's going to work, they might decide that they can't work in that type of a job anymore because they're going to come up with a panic attack and might decide to change their job and go for something else.
Okay, then we've got 3 minutes, and let's talk about, you have about 5 or 6 points on what you do about these. Where's the hope? What can we do to manage the effects on us from natural disasters, all the things we've mentioned?
Absolutely. Very important, safety first, protect yourself. Protect yourself, protect the people around you, protect your family. Direct, explain to them where you want to meet, how you want to, in case someone gets lost or communication is lost, how are you going to get back together?
Okay.
And then connect with agencies, different, Red Cross, FEMA, whatever different agencies that are involved with helping your community, connect with them. And then important to get into a routine, take care of yourself, get plenty of rest, get enough exercise so that you form some kind of a routine in your life.
Okay.
Also, helping others is very important. It gives you a self of control. So if you can help others who are in the similar situations, absolutely, that will give you some sense of control and support. And you can't forget prayer. That is very, very important. Pray that for the safety of yourself and others, and pray for strength and courage to deal with the issues that you're going through.
Okay, and then coming to that spiritual again, what if you're just having problems getting your mind around why God would allow this or whatnot? Have you helped people through that?
Yes, well, it's natural sometimes for us to question God when we are going through difficult situations, or when we have lost our loved one, or we see our loved one dead. It is natural sometimes to feel angry and feel resentful and hateful.
Work through that.
Yes, but you also have to keep in mind that our God is greater than any problem that you can go through.
Amen.
And He has the reasons why things happen. And when we go to heaven to meet Him, we'll get an opportunity to ask Him why this has happened. But while you're going through it, you need to say that He is in control, and practice that. Also, it's important to have faith that God is watching over you through what you're going through. And even though if you've lost your property or your loved one, that He's in control and He will help you. And He's in charge no matter what. So keeping that in mind, keeping in mind that this worldly things and the possessions are not the focus of our mind. We have to keep God as the focus. And then whatever happens, He's in control.
Amen.
And we do our best.
Thank you so much, Dr. Borge, for joining us. This has been very helpful, and I hope as it is aired again and again, it will help people with the very things that your heart's desire to help, those that are experiencing natural disasters, knowing that God is there and having the specifics to help them. Thank you for joining us on Health for a Lifetime. May God bless you today.